Welcome back to the journey, everybody. Today we are going to jump in and put the life of a doctor of physical therapy under the microscope and try and explore a little bit more about what that looks like and just kind of all of the extra things that might be going on behind the scenes that you might not know about. At the end, we'll also talk a little bit about just the healthcare system in general and why doctors might get so behind with, what seemingly, they come in and see you for 5 minutes. So let's jump in. We talked a little bit about my routine in the last video. So if you're wondering about just how I set up my day, you might go and revisit that video. But today, I'm gonna start with what it looks like when you first walk in to our physical therapy clinic and what kind of the steps you go through as a new patient. So typically beforehand, you're consulting with our front office staff and they're giving you lots of information and walking you through kind of the onboarding steps, if you will. And they might have you fill out some outcome measures, fill out some information about why you're coming to see your physical therapist that day. And that's really important. That helps us know what we're walking into and kind of helps us maybe already generate some hypotheses on why you are hurting the way that you are. So I implore you, if you do go into see a physical therapist, do fill out that paperwork and do a thorough job, because the more you do on the front end, the less you have to do in initial evaluation, and the more treatment that you'll get that first day, the better you'll feel. So after you've done kind of your initial onboarding, you get to your initial evaluation day, your therapist will bring you back to the treatment room, and there we're gonna start with an interview process. We're gonna confirm all of the things that you put on paper and maybe get a little more detail about those. And then we're gonna do a hands-on assessment. Look at your range of motion. Look how much you can do, or how little you can do, maybe in some cases. Test your strength, look at your nervous system. Depends on what you're coming to see us for, but we wanna make sure that you're in the right place, that you're not needing to go get a surgery to stabilize something that's really unstable, that could really severely injure you. After we confirm that you're in the right place, that we think that we can help you, we're gonna dive in even deeper to that hands-on exam, looking at, what you're able to stabilize while, being mobile. Can you keep your shoulder blade stable while you bring your arm overhead? What does your shoulder blade rhythm look like as it goes overhead? So these things and more are all of the types of things that we're gonna look at in your initial evaluation. And we're gonna give you some homework, because let's face it, this journey is a partner team. We're here to guide you through the steps of what you need to do to get better. And it's up to you to execute on that plan so that you can be the star of your life. So that's kind of the evaluation process and what my day looks like. When somebody comes in a follow-up, we also do a little bit of evaluation. We wanna know, how'd the homework go? So if you didn't do it, it's tough to gauge what we need to do that next day. So do that homework, give us some feedback, and then we'll pivot and adjust. If it hurt you, okay, great. We've got more information. Now we can kind of switch gears and try something a little bit different. So that is the brass tacks, the nuts and bolts, if you will, of what therapy looks like. It's a collaborative effort between the patient and the therapist trying to come together and figure out why the person is hurting and what we can do together to make you feel better. But there are tons of other extra pieces in our clinic that we also have to contend with. We have a really close-knit team. We call it a family. And sometimes our family hurts, and us being empathetic people, we can't just say, oh, it'll get better. Oh, you'll be fine. Well, we want to offer our services to them to try and help them feel better. Because not to mention, we want them to feel better, but we also benefit from cohesive working team. So we want everybody to be operating at, the best that they can be. So 2 of our colleagues right now they're just not feeling great, unfortunately. And, just helping them out with some manual treatments, some joint mobilizations, some soft tissue mobilizations, helping them to try and get through the day, and offering advice sometimes is tough without a thorough exam. But when you need to see another healthcare provider, that's sometimes a hard pill to swallow for a healthcare provider. So that has been my advice. It's time to take that next step to these 2. We also have support staff in our clinics, we have physical therapy technicians who act as the extension of physical therapy, of what we do. And because of the nature of healthcare, we have to see a lot of patients, and we can't be present all the time with you for your full session. So we utilize the PT technician to help you along your exercises after we've come up with a treatment plan together. So the technicians are really important, and they are only as good as we've trained them to be. And I think this is where some of the business folks get this wrong is, oh, nobody can work. Nobody wants to work. What's wrong with this generation? No, all of these things are fine and good. You can have your opinions, but your support staff and your staff is only as good as you've trained them to be. So if you want them to do the job better, train them to be better. And that's one thing that we really want to do, because we want to provide the best care for our patients. And so we take great effort in training our folks to do a really good job, to know the exercises, to know why they're doing the exercises, so they can relay that information to you. I've also taken some extra responsibilities in order to further the mentoring, so to speak, across the board, not just in our physical therapy techs. I'm putting on and helping run employee empowerment meetings in our weekly meetings every Wednesday. So this week, we are going to dive into our assessments that we've done. And these take our math, reading, learning styles, and behavioral traits and integrate that into a profile about leadership. And we'll use that to generate some actions that we can start, stop, and continue in order to really optimize who we are and our role in the team. So I really find this stuff fascinating in diving deep into who we are and utilizing that to make ourselves better. The final piece that I want to talk about is lots of the back end stuff. This is patient management, not necessarily patient care, although it plays a role. It's not the one-on-one contact that you would experience when you come to a PT clinic. Patient management is all of the communications that we go through with other healthcare providers, with your insurance company, and with all of this stuff, the back end management of trying to make sure that all of the ducks are in the row. And as we go about this, I'm gonna comment on things that might affect your care, might affect why your doctor's late, why he only spends a few minutes with you, why, it's just not the best experience because there are all of these other clerical things that the provider needs to do throughout the day, and they take up a lot of time. So the first thing I want to talk about is looping in a new care provider that I've deemed necessary to help me in treating your condition. So two things have come up this week: orthotist and an ergonomic kind of assessment of a person's workspace. So an orthotist, you might be more familiar with a prosthetist, and these people fit and create and mold orthotics. You might be familiar with shoe orthotics, but they can also do things that are called AFOs, ankle foot orthoses. And these mainly, they have a couple different uses, but mainly are used in the compensation of drop foot. So if a person walks and they don't have the appropriate toe up dorsiflexion mechanics, to maybe they don't have the nerve on the front of the shin, the tibialis anterior is flaccid, they will hit their foot on the ground as they go to bring it forward. And this ankle foot orthosis goes underneath the foot to prevent the foot from dropping down. So it may be rigid, but you're not gonna catch your foot and fall. So that's not something I do, and it's not something I fit. So I need to loop another person in, and finding the right person, even in a big city like Dallas, can sometimes be difficult. Now, another thing is I'm sending a letter to patients and an ex-patient's company to try and get them an ergonomic chair, something that supports their body from long hours of work, because she does a lot of sitting. And so just typing the letter, making sure that executing on the ergonomic chair is as easy for the company as possible, so that they don't go, nah, we're not gonna do that. So That's some 2 examples of this week, some outside management that I've had to do. Now, on top of that, we talked about these kind of clerical things that provider might do. They need to document. They might need to call another doctor just to get a little more information on something that was in their documentation. Heck, you might even have some technical difficulties. Maybe the air conditioning goes out, and that might affect the exercise that you're doing. Maybe the internet goes out and they can't pull up your chart, so we can't look at what your exercises were that we did last time. These are all things that might impact your experience and might delay the person coming in to see you, delay he or she who's your doctor from taking your vitals and you doing their exam and on all of that, because they're just working on the back end for you. A lot of times for PT, we're emailing you, we're sending you home exercises because you're touching base with us after the fact, after your session. That can take away from some of our patients that are in front of us. But we want to try and answer those emails as quickly as possible so that you can continue on your healing journey. So I hope after watching this video, you kind of have a better understanding of what to expect from coming to your first physical therapy appointment, and just sort of the understanding the healthcare system and why it's so inefficient sometimes and why it's so frustrating. If you have any questions about any of those things, feel free to leave me an email or leave a comment down below. Thank you all for spending some time with me today, and we'll see you all in the next video.